Hi, I'm Meredith. I'm an athletic training student at the University of South Carolina, and today I'm going to be going over how to take a history for your patient. So first of all, I wanted to go over some skills that you're going to need for your medical exam. It's important to be an active listener, practice empathy, build rapport, ask open-ended and why questions, allow for appropriate silence, and be aware of your nonverbal cues. It's important to avoid any close-ended, leading, or probing questions, and you'll want to watch out for any red flags that may point to sinister pathology. So for the general flow of the medical history interview, you'll first want to wash or sanitize your hands and welcome the patient. You'll want to introduce yourself and your role and ensure patient readiness and privacy. You'll want to remove any barriers to communication, and so this may look like sitting down in a chair or a stool so that you can be eye level with your patient. Finally, it's important to ensure patient comfort before starting the medical history interview. Then you'll want to conduct your history interview. And then before you wrap up, you'll want to give your patient a brief summary of the information that you'll be walking away with, just to make sure that you have taken an accurate history and so that the patient knows if they have left anything out. Now, I wanted to include some acronyms that you can use to remember to remember what questions to ask in your history interview. Now, it's hard to think of a general script when taking a medical history because every patient and every conversation is going to go differently. But these acronyms can help you remember what topics are important to touch on in your medical history interview. If your patient is experiencing pain, the OPQRST acronym is important to remember what kind of questions you want to ask when it comes to pain. Here's some more acronyms that you can use to guide your questions. The HEADS acronym on the right, that one's really important for social determinants that we tend to not think about when it comes to taking a medical history interview. All right, so now that I've gone over this information, let's see it all put together. Two other athletic training students are going to reenact a medical history interview so you can see how everything flows together. All right.
Hi, my name is X. I am a athletic training student here at USC. What is your name?
Haley.
Haley, nice to meet you. What are your pronouns, if you don't mind me asking?
She, her.
She, her? Cool. So I'm just gonna come in and kind of get started with a couple of questions, kind of see what's going on, and then I'll take this up with my head AT and get you started with the program to kind of help with all your issues today. So what symptoms are you having?
Upper shoulder pain.
Upper shoulder pain? Specifically on what side, left or right?
Left.
Left. Cool. How long has this been kind of going on?
Like 3 or 4 days.
3 or 4 days. And can you kind of describe the symptoms you're having with that shoulder pain?
Yeah, it's just kind of like tight and spasming.
And would you say this kind of bothers you while you're asleep or in your sleep?
Just trying to like fall asleep, but not like while I'm sleeping.
Do you have any history of shoulder injury?
Mm-mm.
Alrighty. Now, do you have any allergies?
Motrin.
And no food allergies?
No.
Have you had anything in the past hour or when it comes to food or any drinks? Well, not hour, but a couple of the last 24 hours, to say the least.
Yeah, I had breakfast this morning at like 10:30.
Okay. Cool beans. And again, you've never had any shoulder injuries in the past.
Mm-mm.
Do you take any medication?
No.
So I'm gonna pretty much take all this information, again, talk to my head AT, and kind of discuss what a further plan is to get you back out there.
All right.
Got any questions?
Nope.